welcome everybody if you can see me. And if you're joining us for the first time, thank you for joining us. We're glad you're here. Hopefully you learned something from this forum. So before I start, I'd like to talk about why we do what we do. So here in Initiative for Cognitive Therapy, we like to provide training for people, and this is for all walks of life, right? Whether from a therapist perspective or from a spiritual leader or from any kind of professional. We try to integrate what we teach so that it's feasible for people to understand or integrate. It could also be what I'm going to train today could also apply to your home. We are the first line role model for our children, right? And so there are ways that we can approach our children, and that is also to factor generational cohort, right? And different stages or different phases of timeline for growth or generation for us to understand and see how best we can apply this. So I encourage you to have an open mind, but also please ask question. What we'll do is for you to ask question at the end so that this would flow fluently so that we don't have glitches as we do this. Okay. Um, a little bit about myself. My name is Stephanie Okolo. Um, I am a therapist at first, right? And then other credentials follow. So if you want to know much about me, you can find me on LinkedIn or on our website and see what we do and who I am, as well as other boards of director. So effective intake for successful client session. So understanding a client cultural and spiritual background is a vital component of effective therapy, as these factors often shape their worldview, um, coping mechanism, as well as preferences for support. So cultural traditions and spiritual belief can significantly influence how individual experience and process challenges, right? Particularly during moment of grief, during moment of stress, and process and how they process challenges in general. By creating a safe, which is imperative, creating a safe, respectful space to explore this dimension, a therapist can build trust and develop interventions that honor the client's unique identity. Okay. And then this training scenario you have a training scenario that provides an opportunity to practice culturally, spiritually sensitive intake techniques, enabling participants to engage with client in a way that affirms their values and promote holistic healing, right? Usually I'm a fan of, if you've listened to some of my talk, I'm a fan of saying that you can give what you don't have. And so sometimes, what wisdom is gaining knowledge and impacting it, yeah, right? And so learning this would give you a different perspective on how to help people because you're equipped with this knowledge and you'll be impacting it to other people. So that's also part of what you do. You also know that in a session, in a therapeutic session, whether it's in the pastor domain or in a therapeutic domain, therapist domain, or any sphere of life, you have to understand that the importance of therapeutic alliance. So when I talk about therapeutic alliance, I'm talking about that relationship between you and the client, right? You hear me talk about the client, the client, the client. That's the person that you're trying to help. So the importance of you trying to help these people to get to a better state of life, you have to build that alliance, that relationship for them to trust you, for them to know that it's a safe place, for them to be able to be vulnerable, right? And in order for them to get there, you have to have a curious mindset. So curiosity is vital in a therapeutic session, being able to be willing to understand, but also identifying your biases, because sometimes we have unconscious biases, and even the ones that are conscious that we know, how to not allow it impair what you're doing. So the things we'll be talking about today, you hear me, you will talk about the introduction of intake, which is what we just did. You would hear about the cultural and spiritual consideration, the key component of intake, goals for therapy, practice. So you practice. How we do practice on Zoom is that you have a breakout session. I'm hoping that today the technical or technology department are on board, to help us do this breakout smoothly. So we'll talk about, you guys will have to practice, but before you practice, I'll walk you through how to do that. So while we're in this session, I'd like somebody to volunteer to be a client as we go forward. Let me know if you're wanting to participate in the scenario that I'll be practicing and be a client. And the next thing, one of the things we'll also address would be conclusion and questions. So if you have any pending questions, so you let us know either by texting on the chat, somebody else will read it out, or by also, just putting your hands up and we'll address that. I hope that is clear enough. Okay, I just see a hand up, Ms. Hafizat. Let's hear your question, but we said questions should be at the end of the session. But go ahead, let's hear your question. What is it?
No, it's not a question that I have. I'm just raising my hand. I would be the client for the...
Okay. All right. Okay, so at least we have identified client. So we would go with Ms. Hafizat as our client. And so Ms. Hafizat, as we go through the slide, when you see a place where it says therapies and client, just know that you'll be the client and you'll be reading what is written there. Okay?
All right, ma'am.
Okay. Again, I've talked about what introduction is all about. So understanding the client's cultural and spiritual background, it is a vital component of effective therapy. These factors often shape their worldview, coping mechanism, and preferences for support. So here is would work on a girl called Enobong. So Enobong is a 29-year-old a client who, her presenting concern is that she has anxiety and she has difficulty managing stress at work. So Enobong comes into the therapy session, and I'll be the therapist, and then I'll walk through receiving Enobong. So I would say, hi, Enobong. Thank you for coming in today. Before we get started, I want to explain how today's session will work. The intake session helps me get a complete picture of what brings you here, along with your background, so we can figure out how best to work together. Everything you share would remain confidential, except in situations where I am legally required to share information for your safety or someone else's. Does that sound okay to you?
Yes, that sounds good.
Good job. Good try. Okay. And then I will proceed by saying, great. Feel free to ask any questions or let me know if you need a break at any time. And the reason why I do that is that, sometimes people come into the session and it's very sensitive. The issue is very sensitive for them. And so at some time, we just also have to understand that we can pause and we can give them a break if they do need it. But we have to create that room for them to be able to request that. When we talk about confidentiality here, I like to let you know that based on what I do, I'm a chaplain in the United States Army, which means I'm a soldier. And so for us, it is different way of confidentiality as compared to a regular therapist. I'm coming from the perspective of a regular therapist and not as my job description. So I want to differentiate that, but I would like to explain the difference, right? So when you have the medical practitioner as well as, so when I call therapists, they're also medical practitioners and they fall in that domain. So when you have them or you have a doctor, you would go in. A doctor's part of the things that the doctor would do is to maintain everything has to be confidential, right? So as a therapist, you maintain confidentiality, but when the person is a threat to themselves or someone else, then you get to seek help or relate or liaise with somebody to keep the person safe, whether it's the police or other entity. But as a chaplain, what we do is we have what they call extended confidentiality, and that is called privileged communication. In this view, the person who is the client own that communication, which means that you do not have the legal standing to seek help outside, until the person gives you the go ahead to seek help. It's just like a priest, a Catholic priest, that you go into confession and he stays there and he doesn't go outside of that. Now, somebody would ask, what if the person is at risk? It is my job as a chaplain to talk them and convince them into going with me to go seek that help. That way, when they go seek that help to other professionals, then they can raise the alarm if the person is a threat to themselves or someone else. So that's the difference. So we'll move along. So now, how do you collect information when the person comes in? What are the things you're looking at? First, you're going to take information, personal information about their basic demographics, which is their name, their age, their contact. Why do you need contact or emergency contact? Just in case things, escalate in a wrong direction. So you're able to contact their loved ones or a support system that's available for them. Then what would you look at again? You look at what are the presenting issues, right? And it has to be open-ended questions to identify primary concerns. But before you go there, for me, I like to also explore on the right-hand side on the slide, you see family, social history. I want to understand what is really going on, right? Family dynamics, significant relationship, or is there a support system? Who is somebody that you can run to when something happens? So I want to explore that. I want to explore their lifestyle and daily routine. What are they doing and what should they do differently? But I'm not suggesting now, I'm just getting to know them and explore this. I explore the strengths and resources that they have available. If they even have a coping mechanism when things happen. But back on the left side, the presenting issues has to be an open-ended question to identify the primary concerns, right? You explore the symptoms. How long has the symptoms been? And how does that impact their daily living? And then also, before you even jump into therapy, you want to understand, are there medical concerns? Are there medical implications? Are they on taking drugs, medical drugs, or do they have past diagnosis and have they been treated before? And if they have been treated before, how did that work and how didn't that work? And we'll walk you through that process. Okay. So again, I hope my client is available to respond to me. Okay.
Yes, ma'am.
So, all right. Thank you very much. So to get started, can you confirm your full name and the best contact number for you?
Eno Ogon Johnson, and my phone number is 555-123-4567.
Thanks, Enobo. Do you have an emergency contact person I can list just in case?
Yes, my sister, Emily. Her number is 55987-40543.
So now we move into presenting concern. Can you share a little bit about what brought you here today?
Have been feeling really anxious and overwhelmed at work. It has been hard to manage everything, and I feel like I'm always on edge.
That sounds really difficult. How long have you been feeling this way?
Maybe 6 months. It's gotten worse over the past few weeks.
Thank you for sharing that. We'll explore this more as we go along. So now we move into the medical and mental health history. Have you ever spoken with a counselor or therapist before?
Yes. About 5 years ago, when I was in college, I had some panic attacks then.
Did you find the counseling helpful?
Yes, but it was short-termed. Things got better after I graduated.
Okay. Are you currently taking any medications or receiving any other treatments?
No, not at the moment.
Okay, thank you. So what this is doing right now is just getting all the medical background, like I previously said, and having a glimpse of what's been happening when it comes to our medical history. So we understand that she had therapy before. We understand that it worked before, and she's not seeking any therapy, and that of course this thing that just sprung up, she needs help and she's not seeing anybody, and which means she believes in therapy. So we're able to help her navigate that. Okay. Okay. So now family and social history. Can you tell me a bit about your family or anyone close to you who supports you?
My sister Emily and I are really close. I also talk to my mom, but she lives in another state.
Do you feel supported by them when things get tough?
Yes, Emily is always there for me.
Okay. So you could hear in this scenario that she's talking about Emily. So it means she's closer to Emily, like she initially indicated, than her mom. But there is a sense of support when she needs it. She has somebody. And why do we do this? So, whether in a therapeutic session or outside of it, we want to understand that there is that one person she can call, right? And you often hear about completed suicide or attempted suicide, and you want to integrate this and say, okay, is there a support system for this person? When this person needs help, who is available? And that's a question you should ask yourself, even as a therapist or as a care provider. If I need help, who is that one person that I can call that will be readily available to help me? They don't have to be skilled in providing therapy, but at least they are able to just get on their feet and provide the little support that they can, and just to save a life. So now we move to lifestyle and daily routine. As a therapist, I would say, what does a typical day look like for you?
I wake up, go to work, come home, and try to relax by watching TV or scrolling on my phone. I don't have much energy for anything else lately.
Okay. Have you noticed any changes in your routine or habit recently?
Yes, I used to exercise, but I've stopped going.
Okay. So now this is providing clarity about a shift in her daily routine, right? And her daily lifestyle. She used to exercise. What I would further ask is if that exercise was effective. And then I would also explore why, at what point did she stop and what was the reason behind it. But here you see that she is showing some, whether it depends on her, whether it's maladaptive behavior, and then we can see what the adaptive behavior is, assuming exercise was an adaptive behavior. So when you hear me talk about maladaptive and adaptive, I'm just basically talking about negative and positive. So weakness and strength, and however you deem fit. So you can see that here, all she just do currently is just wake up, go to work, come home, and then try to relax. And her way of relaxing is watching TV or scrolling on the phone. The phone could also be a part of the problem. The TV could also be part of the problem. We don't know, and she's doing this because she's trying to cope based on the situation. She's still, there's a sense of hope. She's trying to cope, and then she's finding these things to do that because she doesn't have much energy anymore, to do the things she used to love doing. So that's the process why you do what you do. So now, strengths and resources. Even though, and now this is therapy saying, even though things feel challenging, what are some things you feel you are good at or enjoy doing?
I'm really organized at work, and I have always been good at helping my friends when they are struggling.
That's good to hear. Those words are wonderful strength we can build on. Right now, we're finding the adaptive measure to build on. She's a helper. She cares for people. But also sometimes when you do that too much and then you don't have a source of something grounding you or keeping you, it's just like the scenario I would say, pouring water into the basket, and your expectation is that the basket will retain the water. The possibility of it returning the water is very slim or none. So helping her understand that and walking through, but all this, you're collecting all the data, the vital information to see what ways work better for her. So now we're navigating, through her cultural and spiritual consideration. So understanding the client's culture, spiritual or religious background is important. Impact on their worldview, values, and potential treatment preferences is also vital. So we'd navigate that and see what works well. We may not, go deep into it. Like I told people, the previous training I had, which was last week, we talked about, we did a session about genogram. I often tell people, for me, my sessions are, the intake is always the first one to just give me a view or a clear view or some view of who this person is, what they are made up of. And then genogram is the second one, getting to know the integral part of their relationship and their family tree, and then seeing the medical challenges or even the strength that they have within family. So if you didn't attend the training, the previous training last week, I strongly advise that you reach out to our team to help you go through that video if that interests you, to go through the video and learn something if you need it. So now with the cultural background aspect, I would say I would ask the question, can you tell me about your cultural background or heritage? Is there anything about it that feels important to who you are? I could also ask, are there specific traditions or practices that are meaningful to you? Because I do not want to assume, right? It doesn't matter if the person have the same ethnicity with you or speaks the same language with you. People are different and their backgrounds might differ from yours. So instead of you assuming that this person is Hausa and I'm Hausa, or we understand each other, no, you don't. That's an assumption. So you want to stay away assuming, but rather being curious, and being curious also brings back that therapeutic alliance. It means that you're willing to understand this person's perspective and where they're coming from without imposing your biases, right, or assumptions to it. Questions that you could also ask is, how do you think your cultural background influenced the way you handle stress or challenges? So cultural background could also be made up of grandparents, could be made of society, could be made up of your clan itself and community, or even your environs, depending on how diverse your environs are. So you could be made up of that. So, but how does that influence the way you handle stress? Because some cultures could say, oh, or some parents or relatives could say, suck it up and move on. Some people could just say, oh, look at that old woman. She's 90 years old and she's still surviving. So when there is life, there is hope. And that might not be what you need at that moment. So how do you understand these people? Okay, so spiritual and religious belief. Do you have any spiritual or religious belief that are significant to you? And so if that is significant to them, you can use that as a strength and build upon. How, if at all, do your beliefs or practices help you cope with difficulties? Understanding that and seeing how you can integrate that into the session. Are there any rituals, prayers, or practices you engage in regularly? Would you like this belief to be incorporated? So now you ask the question, not assuming because they have listed it means that it would work for them, right? Would you like this belief to be incorporated into our session in any way? They might say yes, they might say no. So depending on what they agree to. So again, cultural spiritual support system. Are there any community groups, spiritual leaders, or cultural resources that support you during tough times? And you ask this because sometimes all they know is go to their pastor or go to their caliph or imam to go talk to, or their traditional head to go talk to. That's what they would usually do. But for them, they feel that's not the best angle. So ask them that and see if there are other resources that they would prefer as opposed to that. Do you feel like your cultural or spiritual identity is well understood by others around you? Is there anything about your culture or spirituality you wish I understood better? Therapies does not know it all, right? You can just know the little brief information about different cultures and spirituality or religiosity and all that stuff. But be open to learning within that session so that you do not say or make mistakes when you could have just listened. All right. So, and then within that initial, not the entire, but within the spiritual aspect, you would say, thank you for sharing this with me, Enobo. It's clear that your cultural, spiritual background is a meaningful part of your life. As we move forward, let me know if there's anything I can do to make sure our sessions honor those part of who you are. And what would the client say?
Thank you. I appreciate that.
Thank you, Ms. Hafizat. So the next one is we move into the goal for therapy. So collaborating with client to set a realistic and achievable goal, short-term versus long-term objective. And why do you do this? Again, you hear me talk about therapeutic alliance, building that relationship, and so that it's easier for the person to trust you and know that is a safe place for them to work together and get this done. So it's a collaborative measure. So Goal for therapy. As the therapist, you say, if therapy could help you in one specific way, what would that look like?
I'd like to feel less anxious and be able to manage my stress better.
That's a great goal. We'll work together to figure out strategies that works for you. Now, you've known all the things that is required or the basic information that is required. And so closing the intake session, what you do is summarizing the intake information and validating clients' concern, explaining the next step and prepare for the first full session, right? And so sometimes, when they say a keyword, it's important to use the word that they use to summarize what you've heard, validate that you have heard their concern, and that you're eager to work in with them to make sure that they get to the state that is required of them or that is good and necessary. So I would say thank you for sharing so much with me today, Inobo. I can see how much this has been weighing you down. And I'm glad you reached out. Based on what you have shared, we will start by focusing on managing your anxiety and finding ways to make work feel less overwhelming. Does that sound good?
Yes, that sounds great.
Wonderful. I'll see you next week and we'll start working on some specific strategies. And so, what you're doing here, understanding, letting the person know that you have heard them, and also applying empathy. We're in this business. I call it business because whatever you do, it's business. So we're in this business together. We're helping each other. For me, I'm gaining clarity and information about this person. For the other person is getting the support and help that they need, right? And so we understanding each other and finding a measure to work things together is what's imperative. So having that in mind, it's an integral part of what we do. So now we will look at practice because I wanted to stay precisely on time. And so we'll look at practice, but don't be scared. Before we go into the breakout session, I'll give you a scenario and then we'll walk through it. What I would encourage you to do is take a picture of what you're looking at, the scenario and everything, so that when you go into the session with the things that I listed out for us to address, you're able to practice this within your group. Okay, so scenario for participants to practice. We're practicing cultural and spiritual consideration. So the scenario name is exploring cultural and spiritual dimension. And the client name is Maria Rodriguez. She's 34 years old. Presenting concern, Maria is experiencing feeling of isolation and difficulty managing grief after the recent loss of her mother. And the background information is Maria is the first generation immigrant from Mexico who has lived in the United States for just 10 years. She is Catholic and attends church occasionally, though her participation has decreased since her mother's passing. Maria expresses that her family in Mexico has been very supportive over the phone, but feels distant due to being physically apart. Maria mentions that she struggles with balancing her cultural identity while living in a predominantly different cultural environment. She has shared that some of her grief is tied to cultural traditions she cannot fully participate in, like Dia de los Muertos celebration, which were significant to her family growing up. So before I go further, I'm opening to people to list her concern. What stood out, or what are the things that stands out for you? Can somebody volunteer to point exactly what her, some people say red flag, but this is not a place for red flag. What her challenges are, or what are the things that stands out? Could you tell us your name?
Divine.
Okay, Divine. Thank you. Okay, go ahead.
I think she's finding it hard to fit into the new environment that she is. It's
Okay.
different from, and it's not her usual kind of people. The language barrier and some other
Okay.
things.
So you're saying different environment. What else?
Language, cultural diversity.
Cultural diversity. Okay. Go ahead.
Then the loss of her mom is also a problem.
Good. And so her mother passing. Okay.
I think that's all.
What about first generation immigrant from Mexico and who has
Yes.
lived only 10 years? So she's yet to, integrate properly. How
I'm not
about,
seeing any of her relatives for a long time.
there you go.
Especially if it's
Yeah,
yes.
although she has expressed, the family members have been very supportive, right? So this is strength, right?
Yes.
But you see the buff here, she feels distant because she's not physically there. Here,
Yes.
there is grief because of the loss, and he says grief is tied to that because she cannot.
Cultural traditions
There you go. There.
such as the dialogue.
Good. And so she has listed so many things that is impacting, this feelings of isolation and difficulty managing grief. Does that make sense?
Yes.
Does anybody have question on this before we move further? Okay, because I'm asking for the question before you go into a group. I need you to, if you need clarification, this is the time to explore that. Okay, so since I didn't hear anything, it means people are good. So we'll move further. All right. Do I still have my client?
Yes, I'm here. Mommy.
Okay, so hold on. So here is what you would do. Mr. Emmanuel will break us out, take a picture, and I will not be your therapist. So within your group where Mr. Emmanuel would distribute you guys to, one person would volunteer to be a therapist and another person would volunteer to be a client. And you're just following the steps to get into explore what's going on with Maria. And then when you're done, you'll come back right to the main session and we'll explore ideas, suggestions, and other concerns that you have. I think that's simple enough. Do we agree to that? Okay.
Yes, ma'am.
All right, Mr. Emmanuel, please help us. Hopefully, people took a picture of this. Can you just help us split people to the group so they can practice it?
All right, ma'am.
All right. And I'd like you to give about 10 minutes so they can just rotate within themselves and practice as much as they can.
Okay, ma'am.
Thank you.
All sets. Can I open the rooms?
Yes, please. I'm still seeing people here. It should be just you and me. Okay, they've all joined now. Thank you.
Okay.
And you did time it, right?
Yes, ma'am.
That's good. How many more minutes? Well, the thing will automatically send them out, right?
Yes, ma'am.
It would have a countdown.
Yes.
Oh, I didn't show them key question for practice. It's okay. Okay, we'll stay on this.
Okay, we are set to go.
I wanted to have a contest, right? A contest here, but it's not. Okay. Go ahead. For those who are back, welcome back, welcome back, welcome back. What the question? No, we just have 5 people back. Okay. All right. So with the 5 people being back, we were going to do a contest, right? And so after coming back, we're going to do a 10,000 Naira contest. And what we're doing is that with what you have learned in a family setting, how would you talk to a child who's having difficulty? So we're looking for who would walk us through that using this technique. If you have a child who's having difficulty, how would you approach that child to help the child? Is anybody willing to volunteer?
Yes, let me try.
Okay.
If a child is having difficulty with his studies as a result of maybe he lost his mom, for example.
Okay. Let's say within your own family session, if the child failed in school, let's use that scenario, and came home, how would you use this technique and approach the child?
Well, assuming the child's name is Amina, for example, I would call Amina, come over here, have a seat. What is wrong with you? Why is your mood down? She'll be like, today at school, maybe the maths they give to them, she got 0, and then her classmates were making jest of her or something, and that's why she's unhappy. I'll be like, is that why you are so sad? You can always improve yourself, Amina. For the fact that you got 0 today doesn't mean you cannot get the whole thing tomorrow.
So what you're doing now, you're jumping ahead. So what you're doing is you're not exploring the dynamics, right, of what surround the failure. You're already jumping to motivational talk. You see the difference?
Okay, yes, yes.
Oftentimes as parents, we want to solve the problem, right, and jump onto it. The aspect of pulling back and getting to know all the dynamics that impact Amina failing is the critical aspect of it, right? What would have been the thing that would have made Amina not pass? You begin to explore that as a parent, right? What would have been the challenges? What would have been the difficulty, right, of why Amina did not pass? And Amina might be, if the environment is safe, right, and comforting, Amina can be vulnerable. I can say, oh, maybe I didn't understand what I was studying, right? Or maybe I slept late. I was distracted.
Doctor, someone else wants to try.
Oh, sure. Go ahead.
Dr. Mfonbasi.
Oh, okay. Go ahead. Go ahead, Dr. Mfon.
Hello, everyone.
Hello.
Yeah. So if a child is having difficulty, like you said, maybe in his or her studies, and the child, how did you know the child was having difficulty? Maybe the grades, she's brought back the result, or the an assignment that was given and he didn't do well. So the child comes back, you have to sit the child down, walk the child through series of questions that will reveal what actually happened. Like, how are you feeling today? What happened? You usually do better. So what happened this time? The essence is to make the child talk, and not assume that, oh, this or that would have, gone wrong or something, So you will ask the child vital questions. Did you understand? And the child says yes. Okay, if the child understood, why didn't you write what you are saying? Because when you are talking with the child, you will find out that the child actually knows the answers to those questions that were asked. So why didn't the child, respond according to what he knows? So from there, you could find out that it will reveal a lot of things. It could be the child forgot. It could be the child was afraid. It could be maybe somebody is even bullying the child. Sometimes if the child is doing well, other people could be like, oh, is it only you? And all those things. So by the time you ask series of questions, and first of all, make the child very comfortable and know that you have the child's best interest at heart. And that whatever the child says, you understand that you will help the child, that there is always a way out. You make that child relax, and based on what you have discovered, that's when you now begin to pick on those things and, make the child see the way forward. I'm being very general, like that. So I don't know if it makes sense.
Well, thank you for a good try. Thank you. Well, I guess maybe we'd all accept it. I guess you won that contest. But again, well, Mr. Christian, we're running out of time, unfortunately. And so we would want to wrap it up. But the thing is that there are other factors. It could be tension. It could be brain fog. There are people who just go in. Yeah, there are people who just go into exam tension and everything that studied just went out the window, right? Not because they're not smart enough, but that gives you a sense of how can I help this person or this child so that doesn't happen again? Does this child need a professional therapy, or does this child need an brain exercise to help them? So you can integrate this in the family setting. You can integrate this in church, right? Make the place a safe place, so that like people are not saying, oh, I'm talking to a pastor, I have to panic. No, they have to be vulnerable enough and trust you enough that they can be vulnerable to tell you the exact thing without making things up, because they don't want you to look at them lesser than who they are, And so it is very important that you have this alliance, you have this rapport and this safe net for people to participate and be part of that. Now, we don't have much time. I like who wants to share. Tell me, how did you explore that cultural background? Were there any challenges? And then how did Maria's response guide your approach? And what did you learn about incorporating cultural and spiritual dynamic? If somebody can just run through that for us. Abigail, you want to try?
I didn't get to meet what is going on.
Oh, well, I saw you unmute yourself, so I thought you wanted to try something. You said you didn't get to know. What did you say? What was your question?
Okay, I didn't get to join the Maria's cultural and spiritual session. I think I checked the link, so that's why.
Oh, okay. My apologies for that. I wanted to say hopefully you can watch the recorded, but the recorded did not show the group sessions, or will not record the different group. So maybe we can walk one-on-one when the time permits. Okay.
Dr. Fon wants to try.
Okay, Dr. Fon, you want to try? Go ahead.
Yes, I didn't meet the spiritual aspects, but I met the cultural side down, because he kept, logging me out. When it had to do with the culture of not being able to celebrate the funeral of the mom, it shows that cultural thing they couldn't do back in the US really made her feel disconnected from the family. And of course, that will affect the person's mood. And, so that's what I really learned, that culture plays a role in, the way someone feels or handles grief. Because there was grief in that scenario. So not being able to do the normal cultural thing made her feel worse than if she could have done it. So that's what I learned from the last part that I just watched. So that's it.
Okay. All right. Thank you very much. Thank you very much. So
let me say something.
Okay, go ahead.
Why Maria was grieving was not just because she lost her mom, but because she misses the cultural practice they usually do from time to time. You understand? So that really made her feel down. She was not participating and all that. So that's to show that, yes, like Dr. Fon says, shows that cultural aspect has a better part of a child's life or something, background,
Yeah, that's good. Thank you very much. And so so this is where you ask the question. You have 30 seconds to ask a question, and I have 1 or 2 minutes to answer before we round up. Anybody has a question?
Okay, like in our group, we wanted to know, though this is an kind of an intake, we wanted to know how to move from here, what else to, tell her, because we can see that, she's suffering from isolation, from her maybe tradition or culture, and also the loss of her mom. So all these things are making her to feel bad and depressed, and also being a few years in America is also another big problem. So what would you advise her, at least are you going to advise her to
so depending on the severity of the issue, okay? So if the person is depressed in a way that that they are not able to function, right? And so then you can provide some sort of grounding technique. And so for those who watch the psychological first aid or who were in the training knows all that, about 30 something or 35 of grounding technique, different types. You can use that to ground that person while the person is thinking about it so that the person can practice it at home. So for instance, I'll tell you a typical example of what I do. When the person has the worrying, right, I would teach them one simple thing. They do laugh about it, but then it sounds like a layperson like, oh, that's stupid. So because of this worrying and these things like that, I try to help them have an appointment with worry. So I would help them after teaching them maybe the breathing technique and everything. When this issue happens to the severity of it, then you breathe, and I walk them through that grounding aspect of it, or the 5, 4, 3, 2, 1. And we thought this earlier before. So, and then when I know that they are on a stable state, I tell them, when you go home, I need you to have an appointment with worry. And when you have appointment with worry, set exact time. So for instance, you have appointment with worry at 12 in the afternoon. You go into the appointment with a paper and a pen, and you will not, the minimum you can worry is 15 minutes. And then the maximum you can worry is 30 minutes. And so while you're worrying, write down all the worries on a paper. And so they go in there, they worry, and they write it down and spend all that time worrying. Nobody distracts them. The following day, they go and do that. And the third day, they go and do that. So I do it until when they come back to see me. And so oftentimes, I think I've never seen somebody who didn't get that problem. Oftentimes, they go back there and they're writing about the worry, right? After 3 days, they also write, this is stupid. Why am I even doing this? Right? And so they write all that and all that. And so they come back and we begin to process that worry. If it's an immediate need, we begin to talk about the immediate need, the immediate worry, because we want to keep them stabilized for them to function well. So oftentimes, some of them, they write all the worry. Oh, I cannot go to Mexico, right? I feel, so what do I do next? So if you cannot be to Mexico, they begin to say, okay, but at least I can call, right? And then they begin to say, okay, if I cannot practice this, maybe how can my family help me practice this while we are away? What is sustainable immediately to keep me sane? Maybe, okay, if I cannot participate in some kind of function, what are other ways or other resources? And we help together to find that resources for them. Does that make sense? Does that answer your question?
Yes, Doc.
Okay. All right.
Thank you so much.
Yeah, it's just to keep the person safe for now, and then also we walk about things they have control over versus the things they have no control over. So we build on the things they have control over, and then we try to restructure how they think on things they have no control over. That's the answer for now. Anybody have a question before we round up? One more question? Okay, no more question. All right. Okay, so, well, I want to thank everybody for coming, for attending. I know for some in different countries it's late at night, but I want to thank everybody for coming. You will get your certificate of attendance, and it will be sent to you based on the information you provided when you logged in. Try and join us next time. Next week is going to be an interesting one. I think it's a mental traffic jam. And so we'll be providing training and strategies and intervention in addressing such issues. And so we'll start diving into the clinical aspect of it. We'll start talking about different mental disorders, and then it's going to be a very interactive time. So invite people to join and learn. This is a free training. So invite people to join and learn and ask questions, okay? And if nothing else, or if you have anything else, you know how to reach us at www.cognitiveng.org, or if you're part of our WhatsApp platform, you can just post your question and we'll try as much as we can to address it. Or you can reach out to the admin if you have any pending question that we didn't reach or didn't touch. Other than that, I wish you a safe evening, and I'll talk to you soon. Have a good one.